We're going to learn a little bit about distribution and volume of distribution. So, distribution is the process by which a drug reversibly leaves the bloodstream and enters the interstitium or ECF or extracellular fluid and then the cells of the tissue. So, basically, the drug distributes among the tissues in the body. For IV drug or intravenous drug, absorption is not a factor. For them, the initial phase is distribution phase followed by elimination phase. So what I just said can be understood from this graph. So here you can see a rapid IV or rapid injection of the drug and the serum concentration here on the side. So first of all, the drug readily distributes since it is IV. There is no absorption, okay? And then it is followed by elimination phase. After the distribution, the drug is slowly eliminated from the body. Now let's take a look at what is the apparent volume of distribution. The volume into which drugs distribute is called apparent volume of distribution. It is represented as VD. VD is a useful pharmacokinetic parameter for calculating a drug's loading dose. Okay, so that is what is apparent volume of distribution. Now, how do we determine this VD? Apparent volume of distribution is equal to dose administered through IV by CO or plasma concentration. So this is the basic formula for calculating the apparent volume of distribution. For example, if 10 milligram of drug is injected into a patient and the plasma concentration is extrapolated back to time zero, the concentration is C0 is equal to 1 mg per L, and then VD is equal to what is the dose administered through IV? It is 10 mg divided by the plasma concentration, which in this case is 1 mg per liter, which is equal to 10 liters. So this is basically the VD in this case. Now, what is the effect of VD or the apparent volume of distribution on drug half-life? When VD is large, most of the drug is in the extraplasmic space and is unavailable to the excretory organs. So this is the case in which the VD is large. It is unavailable to the excretory organs. Therefore, any factor that increases VD can lead to an increase in half-life and extend the duration of drug. So increased VD can increase the half-life of the drug, and which can in turn increase the duration of action of drug. So basically increase in VD leads to increase in half-life, so that is the effect of VD on drug half-life. Once a drug enters the body, it can distribute into any of the three functionally distinct compartments of the body water. This includes the plasma compartment, okay, and the extracellular compartment, and then the total body water or the intracellular compartment. Okay, so what is the plasma compartment? If a drug is having a very large molecular weight, the molecular weight is very large, or binds extensively to plasma protein, it is too large to move through the endothelial site junction of capillaries and thus ineffectively trapped within the plasma compartment. Okay, so the molecular weight is very large of the drug, or it binds extensively to the protein. In this case, the drug is stuck within the plasma compartment, And the drug which shows this kind of distribution is heparin. Okay. Now the next compartment is extracellular compartment. In this case, the drug is having less molecular weight and it is hydrophilic. It can move through the endothelial slit junction of capillaries to the interstitial fluid. However, hydrophilic drugs cannot move across the lipid membrane of cell to enter the water phase of the cell. So it can basically move into the interstitial fluid, but since it is hydrophilic, it cannot enter the lipid membrane to enter the water phase of the cell. So it remains in the extracellular compartment. Example of a drug which shows such a distribution is aminoglycosides. Aminoglycoside, antibiotic. And the third one is intracellular or the total body water. If a drug is having low molecular weight and hydrophobic in nature, hydrophobic in nature, not only can it move through the interstitium through slit junction, but it can also move through the cell membrane in the intracellular fluid. Since it is hydrophobic, it can cross the lipid membrane of the cell. So the drug gets distributed into a volume of fluid which is about 60% of the body weight. Example of such distribution is ethanol. The total body water, total body water, it is around 42 liters and it includes the total body water is the plasma plus the interstitial volume or plus the intracellular volume. And now, if we separate out the intracellular volume, it constitutes around 28 liters, and the rest is the extracellular volume, which is around 14 liters. The extracellular volume is plasma plus the interstitial volume. That is basically what is the extracellular volume. And now the extracellular volume can again be divided, as we said, interstitial volume and the plasma volume. The interstitial volume is 10 liters and the plasma volume is 4 liters. And so that is the extracellular volume, 14 liters. The total body water is 42 liters. So this is all about the apparent, the volume of distribution.